Do you know what these photos are? Looks sort of like Swiss cheese, right? They are actually diverticular pockets located in the colon, which is the same thing as the large intestine, and the condition is called diverticulosis. This condition is very common, especially as we age, with the majority of people that are over age 70 having at least mild diverticulosis. However, I have seen diverticulosis occur in young people, as young as in their 30s. Unfortunately, when it occurs in young people, they tend to be at greater risk of complications from diverticulosis, one of those being diverticulitis. The two main complications from diverticulosis include diverticulitis, which is when one of those pockets gets infected, and diverticular bleeding, which is when the patient will have a lot of bleeding coming from the rectum. The two conditions usually do not occur at the same time, meaning if you have diverticulitis, you usually don't have bleeding from it. The treatment of diverticulitis is bowel rest with a liquid diet, antibiotics, and pain medications. To treat a diverticular bleed, we usually have to go in and do a colonoscopy and try to find the source of bleeding, although many diverticular bleeds will stop on their own. The treatment for diverticulosis itself is a high-fiber diet. I wanted to mention the old adage that you should not eat nuts and seeds and popcorn when you have diverticulosis is felt not to be true, based on data showing that these types of foods did not increase the risk for diverticulitis in most people. That being said, I do have many patients who swear that when they eat a bunch of nuts or a bag of popcorn, that they get lower abdominal pain. What's likely happening in this situation is that these foods can be hard to digest and can cause some abdominal cramping. In these situations, I just tell them to avoid these foods then, or eat them in small amounts. Thank you and be well.